Atrial fibrillation affects millions of people in the U.S. If untreated, it can cause serious complications like stroke or heart failure. In tonight's Feel Great Today, we'll hear what causes AFib and how to detect it.
Feel Great Today with Jessica Jukic.
Atrial fibrillation, it's the most common abnormal heart rhythm that we see. 1 in 3 people will develop atrial fibrillation at some time in their life.
Dr. Michael Zevitz is a cardiologist at Aspirus Cardiology Rhinelander. Atrial fibrillation, known as AFib, can be caused by heart conditions, sleep disorders, high blood pressure, lifestyle factors, and family history.
Atrial fibrillation is a chaotic, abnormal heart rhythm. It occurs with chaotic electrical activity coming from the upper chambers of the heart that can transmit to elevated heart rates because that electrical activity then gets transmitted down into the ventricles, and that can cause the heart to start racing fast.
AFib substantially increases the risk of stroke, but there are many safe treatment options. The most common symptoms of AFib are weakness, lightheadedness, shortness of breath, fatigue, and chest pain. Men and women can experience different signs of atrial fibrillation.
Men tend to have more classic symptoms, particularly when we're talking about coronary artery disease or heart failure. They're the ones that tend to have the classic episodes of chest pain. Women tend to have more subtle symptoms. They can have the onset of fatigue or feeling somewhat weaker or some subtle shortness of breath. They are less likely to have chest pain. They're less likely to have chest heaviness.
Dr. Zevitz says women have the same risk of heart disease as men and should not ignore unusual symptoms.
Any subtle symptoms that may concern somebody about having the development of heart disease should prompt somebody to go and discuss that with your doctor.